So just in this video, we're going to do a brief covering of technique of scanning. We're usually going to be scanning horses' legs either because they've suffered an acute injury of some kind, so either an accident or they've been out exercising. The owners notice that they don't seem right, they seem lame, and then gradually over a period of time, lameness has progressed, and maybe swelling, pain, heat and so on has cropped up somewhere on the leg. Or perhaps because of a more subtle lameness, which maybe you've done a lameness investigation on or a workup, you've done some nerve blocks, you have an idea of where you think the lameness may be originating from, and you're really just doing ultrasonography to try to do a bit of a survey assessment of the soft tissue structures of the leg to see if we can find out what the cause of the problem is. Also bear in mind you might be doing this as a follow-up, a repeat procedure following a previous scan, a diagnosis, and then you're monitoring progress and healing to make decisions about prognosis and about ongoing treatment. If you're doing this for an acute injury, it is just worth bearing in mind from a timing point of view that in the initial period following an injury, you will find there are continuing ongoing changes within the soft tissues of the leg, and particularly the flexor tendons, either through ongoing hemorrhage and edema or through enzymatic destruction of the tendon fibres. And so if you scan too early, you may find that either the lesion looks worse or not as bad as it's going to end up being. And so we tend to wait about a week after an injury before we scan to get the sort of optimal images. It's a slightly variable date, but sort of 5 to 7 days is usually appropriate.